Okay, I think we will go ahead and get started. I'm going to share my screen. I have a few slides just for housekeeping items and introduction. Okay, so welcome everyone. This webinar is titled Homelessness, Equity, and Inclusion, and today we are joined by Stephanie Chan from Funders Together to End Homelessness and Donald Whitehead from National Coalition for the Homeless. Unfortunately, Debbie was not able to join us today, but we will share resources from her throughout the webinar. Just a few housekeeping items. This webinar is being recorded, and we will share follow-up resources after the webinar. Continue to introduce yourselves in the chat and talk amongst each other about the topic today. There will be a Q&A session at the end of the presentation. So if you have any questions, please enter them in the Q&A function at the bottom and use the chat for all other discussion. Just a friendly reminder to always just be thoughtful while you're conversing in the chat amongst each other, and to just remember to speak a bit slower for our interpreters today. Just a quick bit about IGH. We are a partnership between DePaul University that is based in Chicago, United States, and between DePaul International, who provides direct services in 7 different countries, and they are based in London. We have a tagline of see it, solve it, share it. That's kind of how we communicate our 3 strategic priority areas of work. See it is the bucket that showcases our advocacy on an international level. We have partnerships at the United Nations where we advocate for policy focused on definition and measurement. Our Solve It bucket of work is where we partner with different regions, cities, and countries to help them meet their goals to prevent and end homelessness in local contexts. And our Share It bucket is our knowledge exchange area of work that includes our convenings, conferences, these webinars, part of the webinar series that we host, and other convenings just to exchange knowledge about best practices. And finally, you can find us on social media if you want to connect with us via Twitter, LinkedIn, YouTube, or Facebook. We would like to acknowledge the land that IGH sits on, which is the Potawatomi, the Ojibwe, and Chippewa lands, which is the land of the Council of 3 Fires. And if you want to learn about which native land you live or work on, you can use that link listed on the screen. And I think that's all the housekeeping I have. I will turn it over to Stephanie Chan, who will moderate today.
Great, thank you, Stephanie. Hi, everybody, and welcome. My name is Stephanie Chan, and I work in the United States at an organization called Funders Together to End Homelessness. I think I may have met some of you at last year's IGH conference in Chicago, but just to introduce myself briefly before we get started, and to introduce my organization, Funders Together to End Homelessness is a network in the United States for organizations that provide funding to end homelessness in the US. At my organization, we believe that in order to end homelessness, we need to create solutions that address the root causes of homelessness. And so in the United States context, that is a lack of housing that people can afford, as well as a lack of financial resources to pay for rent and to pay for housing. So in our work, we talk a lot about how if we want to truly end homelessness, we also need to think about preventing people from becoming homeless in the first place. And so when we think about our work and when we think about solutions, we're not just thinking about how do we get people who are currently on the streets into apartments and housing, but we also think about how we prevent people from losing their housing in the first place. And we think that the best way to do this is to listen to people who are currently experiencing homelessness and to people who have experienced homelessness on what programs and what solutions and policies will enable us to do that and to do that permanently and not just provide sort of short-term or band-aid solutions to address this issue. It is really good to see so many people from all over the world on this webinar. I know that there are people from Australia to Canada to India and Mongolia, Sweden, Uruguay, the UK on this webinar. And I am going to work to speak clearly and slowly for our interpreters. But if I also ask that if I say anything that is unclear or if I use any acronym, to please just ask in the chat box for me to clarify because I want to make sure that everyone understands the conversation that we have. For today's webinar, we hope that at the end of this webinar, you'll be able to hear some examples of how practitioners are working equitably alongside people with lived experience, and that will also foster some reflection about how practitioners, researchers, advocates, and agencies can improve existing partnerships and collaborate with people with lived experience.
Our speaker for today is Donald Whitehead. He is Executive Director at the National Coalition for the Homeless. They are a national network a network of people who are currently experiencing homelessness or who have experienced homelessness. And they are committed to ensuring that the needs of people experiencing homelessness are met. And with a particular focus on civil rights. And they also have a lovely leadership academy, which I think Donald is going to share some insights about today. Over to you, Donald.
Thank you, Tiffany. Can everybody hear me? Hopefully my sound is okay. I'm Donald Whitehead. I am the Executive Director for the National Coalition for the Homeless. The National Coalition is actually the oldest advocacy group that works exclusively with people experiencing homelessness in the United States. The National Coalition was actually instrumental in we actually drafted in our offices the McKinney-Vento Act, and that act was is really still the primary source of funding in the United States for homeless programs. We've been around since the late 70s. We actually were incorporated in 1982 in New York City, and we hold as our first principle of practice that people experiencing homelessness should be involved at every level of our work. And we actually hold true to that principle. 70% of our staff, actually 90% of our staff, and about 40% of our board are people who have lived the experience of homelessness. Some currently experienced homelessness, and others experienced homelessness a long time ago. I personally have lived experience of homelessness, both as a child living doubled up in my grandparents' house and as an adult. So I spent about 5 years on the streets of Cincinnati. And what I learned is that there are a lot of special places in this country that are really in the United States that are really dedicated to making sure that people experiencing homelessness do have the ability to play an important role in the development and creation of programs, and also in the staffing at important positions within those agencies. So I learned that, I believe that, and my work today is really structured around making sure that every single thing we do within our organization is really to benefit those with lived experience. So just a little bit about what we do. We actually provide technical assistance to the Department of Housing and Urban Development, to the Center for Disease Control, to the Center for Substance Abuse and Mental Health Services, working to do that within the DOL, but we, Department of Labor, and we've also worked with the Department of Commerce and hope to do that again. We really worked with them intensely to make sure that the enumeration or census in the U.S. Is actually accurate, and accurate especially when it comes to those experiencing homelessness. We also have a lot of input into federal policy by working with our elected officials. We work with them on a regular basis in a nonpartisan basis. We work with both sides of the aisle. We actually provide technical assistance to states as well. We work with the state of California. We have a grant where we help communities not only bring on people with lived experience, but also make sure that that's done in a racially equitable way. We have a campaign called the Bring America Home Now campaign. That campaign is an effort to organize people with lived experience and those that care about people with lived experience to address 6 pillars that we think are the structural issues that affect homelessness. So it's housing, income, healthcare. We also work on education and training, civil rights, and racial equity. So all of those are separate pillars, and we're working on structural change in each one of those. And the other thing we do a lot of work around education. We have a very vibrant social media campaign to raise awareness about homelessness and make sure that the narrative about homelessness is accurate. We do a number of reports. We have a report being released today about violence against people experiencing homelessness. And finally, I want to share with you another program that has been in development for a number of years. And this program, I'll share my screen. And this program is one that that really actually was created based on my experience and the experience of others who have had to deal with the issue of homelessness and the effort to be involved. So I'm having trouble getting to my slideshow as well. So the issue here within that program called LEDA is that many people have the opportunity to be involved, but we want to make sure that the involvement, hopefully you're seeing my screen now, is genuine and that people are able to be involved in every level. Our belief is that if people are to be involved in every level, when it comes to advocacy, when it comes to program design and development, there is a need to equip people. So the Lived Experience Training Academy is an effort to do that. And I'll go through a brief slide presentation on this, and then I certainly am open to any questions. So LEDA, again, is a leadership development course that equips people with lived experience to be able to share their experience when it comes to the issue of leadership. And again, we're a national network of people. We just recently became a membership organization. We have about 15,000 organizations in our network and about 500 right now dedicated members. Many people contribute and support NCH, but we have actually moved from a board-driven model to a leadership model, and going through all the growing pains in that. And our mission is to prevent and end homelessness while ensuring the immediate needs of those experiencing homelessness are met and their civil rights are protected. We envision a world where everyone has a safe, decent, affordable, and accessible home. So again, the Lived Experience Academy is to equip people with lived experience of homelessness to embrace leadership roles and transform public policy to be more inclusive. The vision was a vision that I originated about 4 years ago. I brought on Dr. Rajni Shankar Brown, who is a professor of organizational development, and she also does curriculum development. She's a PhD at Stetson University. And David Peary, who is an attorney and founder of the Miami Coalition to Advance Racial Equity. The three of us act in a leadership role for the LEADA curriculum. Now, the curriculum was developed by a number of people. One in particular that I think is very important was Jeff Olivet, who is also a very good friend that I've known for over 20 years, but he is currently the executive director of the Interagency Council on Homelessness, and also our grants manager at NCH was a very big part of that. And we came up with this curriculum by doing focus groups with people with lived experience throughout the United States. This is the structure of the program. These are the people that were involved in its development. We went through about a year of planning and curriculum development, and this is what we came up with. And there's a quote here from H.E. Luckock that says, "No one can whistle a symphony. It takes a whole orchestra to play it." So we say that so people understand that no one individual came up with this program. There were individuals represented all over the country. So we use Bloom's taxonomy and the universal design for learning as we present the program. So we use these universal design elements of representation, action and expression, and engagement. Those principles actually guide us through how we develop this process. And universal design is a concept in which products and environments are designed to be usable by all people to the greatest extent possible without the need for adaptation or specialized design. And so the core topics we cover are technology and literacy, wellness and self-care, the history of homelessness, communication, financial literacy, and organizing and advocacy. And embedded and interconnected and woven into each one of those topics are transformative leadership, legal connections, trauma-informed care and healing, public policy, key vocabulary terms, the jargons and acronyms that we use in our work. And then there's extended learning resources and wellness. And there's also, again, a financial literacy component in the training. So we deliver it in 3 different ways. So there's a fully asynchronous online version that should take about 12 hours. We've learned that sometimes it takes a little longer than that. There's a 16-hour version that is synchronous with facilitation at the beginning and the middle. And then there's an in-person, face-to-face instruction. But we also provide consulting services for organizations that want to get people involved in their leadership. Right now, we have enrollments in 14 states. There have been a couple of foundations that were very supportive in both the District of Columbia, Maryland, and Virginia. We have also had cohorts in Chicago and in California that were larger. We were at 133 enrollments about 6 months into, actually about 9 months into what is a year-long hope that we get to 300 people. So we still have some work to do there. These are the prices. I won't focus on this very much, but if anyone wants to know those, I can, well, I'll certainly have the slide deck available. So basically, it cost us about $250 to do this. And it gives us the opportunity to provide a $150 stipend to the person completing the course, along with a certificate of completion, which they can use for their involvement in a leadership group in their community, or they can also use it as employment incentive in communities. So I'm going to stop there, and I will stop my share. And Tiffany, I can answer questions now, or I can wait to the end of the presentation.
Yes, thank you so much, Donald. Just wanted to highlight a couple things that I really loved about what you shared, the collective impact piece that you talked about, working with the intersecting sectors, public health and policy, just to ensure that the lived experience piece is there, and homelessness in general, just making sure that the insights are there from the actual sector. I also loved how you mentioned inclusion of lived experience and racial equity. So hitting on both of those points, I know that can be tricky. Sometimes organizations focus on one or the other, but yeah, that's really great that you all have figured out how to focus on both.
And to that point, Tiffany, I should also share that I also have a company in addition to my role as executive director, which is called Racial Equity Partners. And we do training with people around the country on racial equity issues. We've actually worked with Stephanie on some of that through Racial Equity Partners. And my other role is I am an advisor to the Secretary of Veteran Affairs on homeless veterans. Also meet monthly with the White House to discuss some of these issues as well.
That is awesome, and that's great to know. Thank you so much for sharing that. Just wanted to make mention that we are really sorry that Debbie could not make it with us or join us today on the webinar. She does incredible work in Canada, focused on the inclusion of lived experience. And she's a great partner to us. She's been really helpful and useful to us at IGH. So we will be sure to share resources from Debbie and her colleagues in her absence. And I think we can probably begin the Q&A session. So over to you, Stephanie.
So Donald, I would love to, I have a couple of questions for you. I really appreciate that background, and I know that there are people who are eager to learn more. So there are a mix of people on this webinar. I think there are some people who are direct service providers. I know there are some people who work in government. Can you share a little bit about what including and centering people with lived experience of homelessness looks like in practice, in program design and policy design? Can you share some concrete examples of what that looks like?
Sure, and it certainly depends on the organization. So for our organization, it has become common practice. It isn't there's no learning curve. There's no need to adjust at all. It's just embedded in who we are. And so when we start a project, the first thing we do is find out how it affects people experiencing homelessness. Within HUD, it has actually So I'll talk about federal, and then I'll break it down to the organizational level. So with organizations like HUD or HHS, there is a growing desire and importance around embedding people with lived experience because of the need for some of the nuanced discussions that they bring to the table, the need to understand how effective programs are, and sometimes how programs need additional work to be effective. And HUD is the Department of Housing and Urban Development, and the HHS is Department of Health and Human Services. CDC had the Center for Disease Control started during COVID because there was a need to figure out how to get the message around how to manage the disease, how to get people immunized. There was a very specific need to figure out how to reach those people that were unsheltered. So they actually started to work with NCH and the National Healthcare for the Homeless Council to understand what those issues were. Now, HUD has really taken an additional step. So what the HUD, the Department of Housing and Urban Development, has done is a part of their funding process. People actually get scored on how they can collaborate with people with lived experience in their community, and how every organization funded by HUD has to have someone with lived experience on their board. The same thing for healthcare for the homeless agencies through HHS. So agencies have really discovered the value, and they've really put in place programs that really actually bring that into action versus ideation. And so HUD has created the People with Lived Experience Committee, and every policy that's newly developed by HUD is reviewed by that group. And also they have a racial equity component of it. So there's a racial equity group that does that as well. But it's actually put into the scoring to incentivize that work. Now, one thing we've found is that people are interested in our People with Lived Experience Leadership Academy, our leadership training academy. But what was a little bit concerning to me is that what we found is that on the organizational level, even if people use the Leadership Academy, there was another piece that people are asking for, and that's how to actually bring people into organizations successfully, and understanding, the need for culture change, the need for very specific issues around governance, and when you have their meeting, and most importantly, how people share and don't hoard control. So there's a really big power sharing dynamic that happens at the organizational level. We do see the involvement of people with lived experience on the ground level, so the entry level positions, where we don't see people with lived experiences in leadership. And so that is where we're really gearing, and our next program will be around helping organizations fully embrace in an authentic way and compensate people with lived experience. I hope that wasn't that was a kind of a long answer. So
No, I think that answer was perfect, Donald. And it reminds me of some of the own work I've done with folks in the United States who are trying to think about how they include people with lived experience in their work. And there are several organizations that have stood up things like a community advisory board of people with lived experience, who help inform decisions around programs and policies, and as well as where funding goes. And in recent conversations with some of those groups, this idea of, or this concept of, or recognition of othering came up, and that, it's great that these organizations are, creating these boards and groups for people with lived experience to inform decisions and policies. And to some degree, it's still separate from the actual work of the organization. And so there's a lot more conversation now about how do we not just have this separate group over here, but how do we actually really embed people with lived experience of homelessness into the staff, into the board, and how do we have them be CEOs like yourself? How do we have people with lived experience of homelessness be policymakers and lawmakers and lawyers, and not just folks who are showing up because they have lived experience, but because they are researchers and policy analysts and lawyers, and have all of that expertise and knowledge, and that is informed by their own personal history and background. And so, I appreciate everything you said, because that's what it reminded me of. I think also, as in the work that Funders Together to End Homelessness, my organization, has done around centering lived experience, we have thought about what is the decision-making power and all the different ways to incorporate people with lived experience. And there's kind of a list of things that I'd love to put out there for you to react to. There's the ability to name or define, whether that's naming and defining problems or solutions, or even what questions we should be asking ourselves. There's the ability to set rules or standards or policy, the ability to change those rules, standards, or policies, and the ability to influence decision makers in the choices that they make. And so I think and that can be applied to services that people are receiving every day. That can be applied to policies that government sets, and that can also be applied to research that we do in terms of who is experiencing homelessness, how long people experience homelessness, what it will take to end their homelessness. And so I think maybe if there's for Donald, a question for you. Can you think of maybe a conversation or a decision that changed because people with lived experience were at the table and helped influence the direction of a conversation or a decision, or helped redirect even the questions that people were asking?
Absolutely, I can think of a number of those. The decisions around how to market, how to provide messaging for unsheltered populations during COVID was dramatically informed by conversations with people with lived experience. The other one I think that is really critical to the understanding of homelessness in the United States and probably worldwide, because I know that many countries do kind of follow some of the policy decisions that are made in the United States. So one of the biggest challenges we have is accurate numbers, just understanding who is actually in the population and why they get there. So one of the two ways we come up with that, there's a number of studies that come together for something called the Annual Homeless Assistance Report. There's also a point in time count that happens once a year in the United States, which, is not an accurate count of who actually goes through homelessness throughout a given period of time over a year usually. But a few years ago, I think 3 years ago, HUD started to have a review of the all of the input data that comes into that program by people with lived experience. So they were looking at who gets counted and who was missing, how to change the language to make it more accessible to people with lived experience. And I think those numbers have dramatically improved since then. And so I think that is a fundamental part of how we develop strategy uh, because Congress uses those numbers when it makes funding decisions. So there can't be much more that's more important than that, in my opinion. But it happens on the local level as well. There are uh, groups have to actually sign on now to their community's plan for ending homelessness. And in many cases, they'll look at the plan and there's things missing. We don't have enough shelter in most of our communities. And so it's very important that that point is made to those that have the power to make decisions about it. And people experiencing homelessness are involved on a regular basis in those decisions. I think those are two that I can think of, but there are many, many more that I think are very important. The idea to start
Yeah.
putting resources into unsheltered homelessness at the federal level came through discussions with the U.S. Interagency Council on Homelessness and the Department of Housing and Urban Development.
Thanks, Donald. There was a question in the Q&A box that I'm going to ask, and then I also want to ask my own question on top of it. So a question that came through the Q&A box is, how easy do you find it to help people experiencing homelessness get involved in informing policies and program design? And if you have heard of folks expressing any fears or hesitations because they might not want to be publicly identified as being homeless. My question on top of that question, so I'm going to ask two at once, is, often we've seen that when folks are currently experiencing homelessness, like there is a lot for them to have to think about and grapple with on a day-to-day basis. And even when someone has recently been housed, there's still a lot of support that they need and kind of trauma that they still have to work through. And so what kind of support can we provide to make sure that people experiencing homelessness can authentically show up and feel supported? How do we need to think about their needs and how we set up and create space for them to show up?
So there's a lot in that question. I'll try my best to address all of it. So there's kind of a mixed, a little bit of a mixed bag when it comes to who wants to be involved. One of the challenges in advocacy is that the majority of the people who actually go through the experience want to move on with their lives. They don't ever want to look back. And you're right, they don't want to be publicly exposed as having been homeless. There's a stigma attached to homelessness. In fact, when they've done brainwave studies on homelessness, what they find is that when you show a person a picture of homelessness, the automatic reaction is the part of the brain that exhibits disgust. So there is a narrative that's actually gotten worse over the last few years about someone experiencing homelessness. So people, for the most part, do just want to get on with their lives. And actually, another interesting part of that is when people do get to that next level, they actually other homeless people, so they see themselves as different or better than people experiencing homelessness because they're in housing now. So we've worked really hard to try to combine those groups together. Now, we do have those that will stay, and those people are really motivated by a number of things, like their experience within the shelter system. Some programs, the program I was in was designed to really connect you to service. So my program, in order to get into the treatment program that I went to, you had to do community service. So in order to get the resources, you had to give them. So it really connected me to the advocacy world, and a lot of communities are doing that now. Communities provide incentive, and we do actually advise people to always make sure that when people are being brought into your system at whatever level, that they're compensated for their time. because everybody else around the table is being compensated for their time. But you also do it in a careful way so it doesn't cause harm to benefits. And that's something HUD is actually working on now as well. I do think you have to give people space to remove themselves from trauma to the best of their ability. So I don't believe that you should uh, put the burden of program design and development on somebody who is newly entering the system, who has, all this trauma attached to them. Because whether you get there because of economic reasons or you get there because you have substance abuse or some other behavioral health issue, there's still a trauma attached to it. And I think you should give people time to heal before you ask them to be part of sometimes a very stressful situation. And when you're in rooms designing programs, or if you're in a situation where people are not really seeing you as equal. So we want to make sure that we remove people from trauma to the best of our ability. Now, the opinion of people inside that shelter is very important, but we can do that through qualitative research, focus groups. We can do it in other ways. So I do think you need time for people to heal. And that's my personal opinion. Other people disagree with me on that. But I do think you need to give people the space to be their complete selves so they can be able to contribute in a genuine way into programs. But I also believe in the concept behind LEDA, that it is very, very unfair to sit someone at a table without orientation to the work. So, we talk in acronyms in this world. People should at the very least, know the acronyms. They should know, back to the trauma situation, about their self-care and how to take some time for themselves before they get into this very, very complicated work. The other part of it is that people need to understand, things like Robert's Rules of Order and the budgeting, because often people are sat at that table and they're asked to decide on budgetary issues. So you need some orientation for that. You wouldn't do that in any other profession. So it's very important that we equip people and don't we're not checking a box. We shouldn't be checking a box. We should be making sure that people have genuine, authentic involvement in the work and are just not there because the funder says they should be there or the federal government says they should be there.
Yeah, and I've seen groups sort of think about, who is right to inform what decisions based on their experience and also what decisions are being made. And so maybe a couple of additional examples that I'll offer is, in the United States, there are often encampments of tents of people living outdoors, and local jurisdictions often will go in and move these encampments. And one way for folks who are currently experiencing homelessness to weigh in is on the matters that affect them in that exact moment, right? Like they might be best situated and poised to inform decisions and policies around, if an action needs to happen, what other services and support need to be in place? What are the considerations around people's belongings that need to happen? What will be lost if we move people from one location to another location, versus sort of big policy decisions around budgets and laws and things like that. Often that requires a lot of, as you talked about, Donald, like a little bit more training and education around how to read a budget document, right? And often might require someone to be maybe more stably housed and to have all of their basic needs met so that when they show up to meetings, like, they're not worrying about their basic needs in that specific moment. So there are a couple of questions. I'm so glad to see that there are questions coming through the Q&A box and the chat box, and I am keeping track of them. So there are two kind of related questions in the Q&A box, Donald. One is, do you have advice for people with lived experience about how to get involved in the types of program design, policy making, and advocacy work that we're talking about? And related to that, do you also have any suggestions for folks who have lived experience of homelessness about how to transition from entry level to management?
Yeah, I think, I couldn't give any exact advice on that. I do think it's up to the agencies themselves to have some sort of leadership development within the agency. And it's very important when you bring somebody in to provide mentorship and leadership development activities within an organization. I think the only advice I could give is you have to show people what you bring to the table. So when you get into an organization, you just have to do everything you can to show your capability, and it will happen organically, I believe. When there is leadership that really embraces this issue. Now, that's not going to happen everywhere. I also think it's important to get support from the outside. I know when I was in my transition, which happened probably too quickly for me, I relied on people who were already in those positions to help me to be able to navigate some of the new stuff I was encountering. So I relied on a lot of different mentors myself to help me be able to navigate that system. But I would say also don't be afraid when there's a position that provides some upward mobility within your organization. You have to go for it, and you have to really believe in yourself. But again, it's very, very important that you get some support and mentorship for people who are already in that position. There's a lot of affinity groups out there. One way I would suggest is there's a lot of national organizations that have workshops and webinars and information that can help you understand the issue more. So there's not many courses. There's a couple at universities on homelessness. But I think one of the ways I was able to transition is I really invested in becoming my own historian and educating myself about the issues. The more you know about the issues, the more you know about the nuances of funding and legislation, the more attractive you're going to be to an employer. So one piece of advice was learn as much as you can. Take advantage of all these free resources that are available. If any individual is interested in our Lived Experience Training Academy, it's actually no cost. Those costs that you saw are really for groups of people from a specific organization. So for instance, we had a group of 75 in the DMV area. So obviously there are some costs associated with that, but if you come to us as an individual, we'll provide you the opportunity to go through that course.
Yeah, and I've also, I know that there are other groups in the United States who have people with lived experience on their board of directors, and something that they do for the folks, for the people who have experienced homelessness, on top of providing things like mentoring and mental health support. They also send everyone with lived experience, if they want it, to a course at Columbia University on nonprofit management to also help them obtain a certificate in nonprofit management to help them step into more management roles. So a couple of questions. I know that there was a question that came through the chat box from a friend in Chicago. Hello. Donald, another question for you. Does a job posting platform exist where people can advertise employment opportunities? if they're looking for people who have lived experience of homelessness? Or is there do you know of any sort of database of resumes for people who have completed your training program who are seeking employment?
That is a wonderful idea. I do not think that that exists right now. Certainly, we have not collected the resumes, but that's a great idea. We're always looking for new ways to improve our program delivery. There are job announcements on some of the different uh, um, the word I'm looking for is newsletters and information resources that come from some of the national nonprofits. There's usually a job announcement or two. Many times it's kind of upper level job announcements, but certainly your continuum on a local basis typically does that. I don't know of another database other than the traditional employment databases like Indeed. Indeed typically has a lot of nonprofit jobs, but I don't know if there's a database that actually is in operation within the homeless service sector in the United States.
And I think for other countries, maybe this is something to think about, is if to identify the groups or the entities who are really thinking about how to incorporate people with lived experience of homelessness in the work, and to have them maybe think about sort of the career pathways and sort of training programs, and to have them be a repository of folks who have specific skill sets, who have completed specific training programs and have lived experience of homelessness. I'll say from my own experience, something that we have done when we've hired out funders together to end homelessness is in our job descriptions, we will often try to emphasize that people with lived experience of homelessness are strongly encouraged to apply. We don't just sort of say that, you're invited to apply, but we try to strongly encourage it and send out sort of job announcements to our partners who we know have sort of either boards with people with lived experience of homelessness or training programs and things like that. Thank you for that question. Okay, I feel like all of a sudden there are a lot of questions coming in, which is really great. So there's another question that is maybe for some of the folks on this webinar who are from local and national government. Donald, wondering if you can speak a little bit more to your work with the U.S. Department of Housing and Urban Development, and if there are specific ways that the federal government is beginning to work in partnership with people with lived experience. And another question that I know that you just typed an answer to in the chat box, like, how do people do this work in a way that avoids tokenism and isn't just, one person with lived experience at the table who is recounting their history, but how can government really think about ways to make sure that people with lived experience are not just being asked to recount their own personal histories, and so that they can authentically show up and partner.
Awesome. So I'll address the HUD question first. So HUD again is the Department of Housing and Urban Development, which has primary responsibility for housing people who are homeless in America. And so we have been working with them. I've personally been a HUD TA provider since the late 90s, and have advised HUD on program design and other parts of its responsibilities. But the the program around people with lived experience really, I think, started to have a real concerted effort to get people involved around uh, 2020, 2019. We were approached by HUD because they wanted, first of all, to have people design and advise on policy around COVID. So with the onset of COVID, we created a number of products for, because there were new resources available, HUD wanted to make sure that there was an understanding that there was a need for people with lived experience to be involved, because in their mind, there were a lot of new providers coming on board to be able to access those COVID relief funds. So that was the initial kind of start to the people experiencing homelessness groups. So they then asked me to work with partners to create a committee of people with lived experience that would be responsible for being authors of policy and also to review policy. And so that has grown dramatically. Now other technical assistance providers are creating lived experience committees as well. And there's a whole menu that just got released about a month ago of HUD instructions related to program design, to funding, to how to involve people with lived experience on the HUD exchange. There is hundreds of documents that have been authored, are advised on, are reviewed by people with lived experience. So that's grown considerably. Now, one of the things that's really important about this is in the consulting world, it allows people to earn a really decent livable wage income. So two of my initial providers, remember back in 2020, have bought houses based on the work that they've been able to get through HUD. And, you know, we hold that as a really, really important milestone in our work. Some people have started their own business. So they started out with us and then they branched off to become their own technical assistance companies. Now, and we encourage that. We're not our work is not around NCH becoming better or NCH having some sort of control. We want people to graduate to their own small business, and that's what happens here. Now that small pool of people, probably about 20 to 30 people, has grown, and I think now there's hundreds of people embedded in every facet of HUD work, from the data work to the unsheltered work, to just some of the day-to-day operation of programs. So people with lived experience are embedded in every part of that work. Now, this is something that the Substance Abuse and Mental Health Services Administration has been doing for a long time. The other thing that those people with lived experience are doing is they're reviewing grants. So they actually get to review notices of funding opportunity, or NOFOs, that are called, that HUD considers. So people are actually able to be on the review processes for communities that get resources for HUD. So again, people are embedded in every level, and that is far from kind of a check of the box. It's people with lived experience that happened years ago, and also people who are just recently have resolved their homelessness. Every kind of dimension when it comes to demographics and geography is included: the Native American population and other populations, other underlying intersectionality issues, the LGBTQIA plus population, other marginalized populations are all included. And then there's a separate track for racial equity. So there's a racial equity committee within HUD that also reviews the documents for racial equity. So I hope I explained that, but it's very intense. It's actually growing every day. And a lot of people with lived experience are supplementing their income through these programs.
Yeah. And there is a question around tokenism and how we avoid tokenism. Donald, I know in the Q&A box, you shared that you honestly don't think we can avoid tokenism and that we encourage training for communities. And I'll say that, this goes back to something I mentioned maybe 30 minutes or so on this call around like, we won't be tokenizing people with lived experience when they are in all different roles at all different levels of decision making, from service providers to funders to CEOs to lawyers to policymakers to presidents even. Like, then we're not tokenizing people with lived experience because they're not just there because of their lived experience. They are there because they have a wealth of sort of expertise and specific knowledge that is being informed by their lived experience. And I want that to be the goal for all of us around the globe. And I think, Donald, you would agree with that too, right?
I would absolutely
That's the
agree with
dream.
it. You can't avoid tokenism. It happens sometimes intentionally, sometimes it's not, and that's why there can't be one homeless person at the table. There can't be one person experiencing homelessness because that person it's unfair to put somebody in a position where they have to speak for entire population of people. So,
Absolutely.
one thing we have to make sure of is that in our communities where we have a voice, that we make it a point that it's not just that one person, that it's a number of people with lived experience. And people will find, like when we've done assessments in a community for racial equity, 40% of the workforce has lived experience. So some people will make the point that there's not enough people who want to do this work or who are interested in leadership, but that's as far from the truth as possible. Our challenge is we have more people than we have places to include them in the work, and so every day we're looking for new possibilities there. But you can avoid tokenism by expanding the scope of where you're getting people on your board from. People will be surprised how many people who are in successful situations have had the experience of being homeless. I've known lawyers, I've actually known doctors with lived experience, and researchers and scientists, and it just goes, it really mirrors the general population. So there are people out there that will provide amazing context, amazing nuance to your system, but it really boils down to making sure that leadership is open to removing any power hoarding tendencies that they have. So the door has to be opened by those in charge, and sometimes it's that one person who's willing to do that. But again, I don't think we can avoid tokenism. I see it all the time, but it's and this may be controversial as well. It's also incumbent upon that person who's being used as a token to make sure that there's a succession plan, that they get out of the way as well if they start to feel that that's what's happening, and open up the door for other people with lived experience to be a part of that role.
Thanks, Donald. So I know that we are coming to near the end of this webinar. I want to sort of offer everyone who's listening in just a question for reflection, and then I'll turn it back to Tiffany to close us out. Throughout the last 75 minutes or so, we've heard a lot about different training programs for people with lived experience to help them show up to tables and to give them the skill sets and the knowledge they need in order to help inform decisions. And my question for all of you on this call to reflect on is, if you are someone who has been in a position of power, if you don't have lived experience yourself and you work in at the government level or you lead an organization, what kind of training might you need and what might you need to learn and unlearn in order to give up power and create more space for people with lived experience to show up authentically. So that is a reflection question for all of you. And with that, I'm going to turn it back over to Tiffany to formally conclude this webinar.
Thank you so much, Stephanie. Special thank, well, first of all, I love the reflection question. I think we all need to definitely think critically about that going forward. Just want to thank both of you, Donald and Stephanie, so much for your insights today and just being so generous during the discussion. Really made for a healthy discussion today. Want to thank our lovely interpreters, Lori and Daniel, for helping us today to ensure that our global audience can really participate today. I want to thank our IGH staff for all of their help. And also want to thank Debbie, who was prepared to be here and who intended to be here today with us. And last but not least, thank you to everyone who joined us today and participated for all of your wonderful questions and your insights from your end of the work. Anticipate follow-up resources and including the recording of this webinar. And I think that's all we have. Have a great rest of your day. And if you have anything specific you want to ask us, please feel free to reach out and email us. Thank you.
Thank you.